Hi, I'm Dr. Jay Heisman from the Jefferson County Health Center. I'm here because of this week is the World Immunization Week. It starts on April 22nd and goes through the following week. It's basically a plea to expand immunizations from our country into the world. Right now, about 20 million children outside of this country do not get immunized, even basic immunizations. And immunization is the basic or the most important way to prevent quite a number of illnesses. In our country right now, we prevent 14 different illnesses with routine immunizations. I have a plea to make to all parents from our area. Just because Jefferson County has been identified as a low immunization rate area in the state of Iowa, I would like to make a plea that all parents immunize your child. Yes, I said get your child's shots up to date. It's one of the most important things you can do to keep your child healthy. There are very few valid reasons not to use immunizations. The truth is, vaccination works. Not immunizing your child leaves them vulnerable to a variety of preventable illnesses. Give your child and also my grandchildren a better chance of resisting these illnesses. It's important to not only immunize the child, but it also gives you herd immunity, which prevents the other kids from transmitting the illness from place to place. And as we all know, children are a big reservoir for a lot of different infectious diseases. So get your child immunized. It's the right thing to do. With me today is Chris Estel, who's the Director of the Public Health here in Jefferson County. I'll see if she has anything she wants to say this morning.
Hi, Dr. Heisman. Thank you. Yes, being the public health administrator for any county is a unique responsibility. We work on many different levels with many different community partners. One thing that health departments are responsible to do for the state health department is immunization audits. So that means every year, usually in the fall when school starts, the school nurses look at the child's immunization record, and then they get the charts or their immunization records ready for audit. So with that being said, then the county health department goes and reviews the records to make sure that the children are either up to date on their immunizations. They have a provisional, which means they have part of the immunizations, and they may be missing 1 or 2 immunizations, and then we as the health department write a provisional and give that student usually 60 to 90 days to become current on their immunizations. Or the child has an exemption, meaning the child can have a medical exemption or a religious exemption. And what that means is a medical exemption is that the child either has a reaction or an allergy to something in the vaccine, which is usually highly unlikely that they have that, or they have a disease or illness that prevents them from getting the immunization, such as they're undergoing chemotherapy, or they have an autoimmune disease that keeps them from getting that immunization. The other type of exemption is a medical exemption, and that is based on their spiritual or religious beliefs.
Religious exemption.
Yes. Yeah, what did I say?
Medical.
Medical. Excuse me. Sorry, let me start over. Thanks, Dr. Bell. A religious exemption, meaning that it's based on their religious or spiritual beliefs. Now, with that being said, the audit process is set up by the Department of Education, and each child has to either be current, have a provisional, or have an exemption. Okay, so when the health department goes and audits the records, every child is accounted for. Now, if the school has less than 100 children, then those results are sequestered, meaning we do not release that information based on HIPAA privacy rules set forth by the Iowa Department of Public Health. We work with all of our school partners, private school, public school, preschools, daycares. There are different rules that daycares follow and that schools follow. Immunizations are a way for all of us to prevent disease and illness. We do many things as parents. We have our children wear helmets. We have our children wear protective gear when they're playing sports. We buckle them in on their trip home from the hospital in car seats. We keep them safe, and we want to keep them safe from accidents and diseases. I know that sometimes it gets to be a hot topic or a hot button, especially when disease is circulating in our community. We do the best we can as providers to promote awareness to those preventable diseases. It does go back to what Dr. Heitzman said as herd protection, because all of us that have our immunizations do protect those that do not have their immunizations. In my generation, I do not know what it's like to experience polio, because polio is prevented by an immunization. Just a few years before I was born, though, in the 50s, I seen pictures in my nursing journals of hospital wards filled with children in iron lungs that they were affected with polio. Third world countries still see an increase in that virus that's circulating. It is a preventable virus and disease. I think that all of us as providers, in some way, whether it's medical or school provider, we want what's best for the children. We want to keep them healthy. We want them to strive, and it's a challenge sometimes as a community, as a public health department, to meet the needs of everyone and bring that awareness into the public's eye when a disease is not prevalent. Public health focuses on prevention, and we encourage people to actively participate in prevention. And that is something that I depend on my community partners for. Dr. Bell? Thanks for fixing that
Chris.
one. Yeah, it's
Dr.
nice when they
Heitzman.
can cut and paste and it's not live.
Well, my name is Richard Bell. I'm the head of Maharishi School here in Fairfield and have been a long-time resident. Recently the Iowa Department of Public Health released statistics on the vaccination rates among schools, and our school was quite abnormally low in that vaccination rate. And so, it was something that we wanted to investigate. We looked at carefully at our school. But if you look at those enrollment numbers and the percentages, you also see that they're actually we're a small school, there are actually twice the number of students that are not vaccinated in the public schools here in Fairfield. So I see this not as a Maharishi School issue, but as a community issue, and for us to think about together. From a school's perspective, and we have an obligation to follow Iowa law. So that's, our requirement is that we make sure that every student has vaccinations, or if they don't, they have one of the two waivers that Chris just described, the medical or the religious waiver. And it's very much a decision then by that family. But in my 30 plus years as a school administrator, I've never seen an issue that was as polarized as this is. The intensity of feelings that people have on this are quite pronounced, and we certainly have been subject to that at our school as well. And so I really feel it's very important that parents avail themselves of information like this from Dr. Heitzman and from Chris's office and other sources to consider this issue. We did that at our school. We had a parent education meeting on March the 5th, and we had medical professionals there. Dr. Veronica Butler, a family practitioner, was there, speaking about vaccinations, about the risks of measles, what would happen if there was an outbreak of measles in our community. Dr. Nancy Lonsdorf was there, and Chris was scheduled to be there and provided a statement for us, but
I was
had
sick.
a little laryngitis at the time.
Yeah.
So
I was sick.
For us, that was an opportunity for our parents to be informed, to educate themselves, and I think that's the important thing. This is a very important issue in our community, and especially if there were an outbreak, then we want to know how we would respond and what would the protocols be. So we work very closely with Chris and her office, and make sure that our records are in compliance with the Iowa law at Maharishi School. And we hope that, as Chris said, the bottom line is the safety and well-being of our children and our whole community. So we hope that that's achieved in the best ways possible.
I think the thing too, we have to remember that when we do school audits, that takes into account the children that are homeschooled as well, because I don't have the exact numbers, I could get that, but it's a moot point. But the homeschooled kids, when they come to public school for courses, we count them in the numbers of records that we audit as well. So people sometimes don't think about the homeschooled population, but we account for those students as well. Dr. Heitzman, I agree wholeheartedly with what you're saying as far as immunizations go. I think there's a lot of misinformation on the internet sometimes. We use either the Center for Disease Control's recommendation and follow that schedule. We use the World Health Organization's information.
Yeah, it's very interesting, Chris. If you look at the demographics of people who refuse to give their children immunizations, it's very commonly well-to-do, well-educated, primarily white people. It's a very interesting demographic. And what I find when I talk to people that fit that description, they have a lot of information from the internet, as you said, and at least probably 50 to 75% of it is inaccurate. It's a lot of old data on there that people read that think it's current, that it's not. I wish there was a way to clean up the internet, but I don't think we can do that. But this recent measles epidemic was an example of how things can get out of hand. A visitor from out of the country apparently went and visited Disneyland, and there was a huge population of children there who were not immunized against measles. So there was an outbreak, and that outbreak spread across the country. Not every case of measles in the country during the past few months have been related to Disneyland. There's been other sources as well, apparently. But that one was a big one, nevertheless, and got people's attention. And measles, for example, is the most contagious virus that there is. You can have a patient in a room who coughs from measles, not even have the rash yet in the early stages of it. And when that patient leaves the room, that room is contagious for at least 2 hours. If somebody who was vulnerable to measles walked in there unimmunized against measles, 75% chance if they went in that room 2 hours after that child was there, they could get measles. Pretty impressive rate of progress for that virus. So the things we're dealing with, and measles has a complication rate which is fairly high. You know, a number of children die. I've had children die from chickenpox. I've had children in my care. I've had children die from the flu, both of which were preventable. And that's just, losing a child is unimaginable. But there's 14 illnesses out there that we're immunizing against currently. The vaccines are felt to be safe on a cost-benefit risk ratio. I would encourage parents to get out and get your kids' immunization records checked. If you don't have records at home, if they've been given in Iowa, we can usually track them down from the state's memory bank. Otherwise, we'll sure try to help you figure out what they need. So visit with us, visit with public health nurses. And it's not just Jefferson County either. The whole part of this, Iowa in general has to improve their immunization rates everywhere. And I would encourage people to think about that very strongly.
Thank you, Dr. Heitzman. I agree. The immunization rates, that's just, I want to point that out, that is a snapshot in time. That happens to be the day that the health department was there to do the audit. With that being said, we only audit once a year, but the school nurse can audit again. And I would expect that those immunization rates to be higher. Dr. Heitzman, being a pediatrician, obviously his focus is on birth to 18, but as all of us are adults sitting here, we think about how migrant we are, how we can vacation, be world travelers. If you think about going out of the country, I would highly encourage you, once you start to think that you're going to go on vacation someplace, please go ahead and get your immunizations, your traveling immunizations up to date, just like you have to your passport. And I think people think that the health department can offer typhoid or malaria, those kinds of things. We do not carry what we consider like exotic immunizations. You have to go to a travel clinic to get those, and usually it's a series, and you usually need to start before the week that you leave the country.
Does that happen to you too?
Yes, sir. Just happened yesterday. It happens quite frequently. So the minute you think that you're going to, whether you're going to do mission work or go on vacation, you need to get those immunizations up to date. And we carry standard immunizations, what I consider standard immunizations at the health department for adults. Hep A, Hep B, tetanus, pertussis, MMR, varicella, which is chickenpox. Just because we don't see those diseases as often in the United States, if you're going to Africa for a mission trip, they have polio in Africa. You need to think about that. Look at your birth date. Look at the recommendations. Most of us, if we were born in the 50s, early 60s, you know, they consider that we've been exposed to those illnesses and considered that we have natural immunity. My kids' generation, though, my kids are in their late 20s, they had oral polio. Now it's given as an injection. I know people are worried about the live vaccines. Maybe Dr. Heitzman can speak to that. I know the vaccines that we give that are considered live would be the MMR and the varicella and the flu mist if you were to receive the mist. The rest of the vaccines
That's correct.
Yeah, are not considered live. And actually our bodies build better antibodies with live exposure, generally. So, and that's how we build antibodies as to any virus or a disease, is through exposure. And when you get the vaccine, you're given either a little bit of that illness or something that's similar, that's like that illness, and then your body, generates antibodies. That's the quick science version. We don't need to get into the whole how this really works at the cellular level, but that's how we can prevent lots of disease and illness. But again, I can't stress enough too, if you've moved here, whether it's from the United States or another country, every country provides immunizations differently. So we'll see single antigen, like just measles or just mumps. In the United States, we give the combined shot, the MMR, which is measles, mumps, and rubella. So when we're doing those audits, it's very important that we see those records, or if you come to the doctor's office, or if you come to public health, any public health or doctor's office, bring your records with you. What we don't want to have happen, though, is to give a child immunizations that they may have already had. But it's not going to cause damage to them or hurt them in any way. It's just, why give them an extra shot if they don't need it? Because we're going to treat them like they've not had that immunization. Better to err on the side of safety. Same way if you have an injury and you end up in the ER. I know working in the ER, if you have an injury or an exposure and you can't remember the last time you had a tetanus shot, we're going to give you a tetanus shot to make sure that you don't end up with tetanus and those problems. So,
Yeah, there is, as Chris pointed out, there's an immunization schedule for adults as well as for children. It's important for adults to keep up their tetanus immunizations. It's important for them to get their flu vaccines. It's important to get shingles vaccines if you're of appropriate age. All these vaccines have adult applications as well. It's not just travel for adults.
mm-hmm. Do you guys have a question?
Yeah, I know there's a lot of, like I said, international population in Jefferson County.
Mm-hmm.
How does that tie into this? Because you mentioned it's different in different countries, how diseases are different, vaccines are different. I know that Maharshi sees a lot of international students, so.
Yeah, I mean, we do have a significant international population. Our school's got families from 30 different countries. The university's got 1,400 students from over 85 countries, I think, something like that. All I can say is, I'm going to be sure that we follow the letter of the law, both as a school and in the university in that regard. And I can't comment too much more beyond that, what the requirements are.
We see, our county is a little unique because we do have an international university, just like any other university town, though. It just happens to be we're in small rural Iowa. I know our community colleges. We have nursing students that come to the health department that are from Africa. They're from overseas, and when they're enrolled in that nursing program or that health occupations program, then they have to follow those requirements to be enrolled in that specific program. Same way as other universities. I know sometimes if a child does not receive immunizations as a child and then they go off to university, then at that time, then a lot of universities are requiring immunizations or certain types of immunizations, and that is to protect the health of the general population. And public health looks at health a little differently, henceforth its name, public health, the health of the public versus individual health. But we have to take the numbers of the individuals that are healthy and the numbers of individuals that are protected, and then look at the ones that are not, and then promote wellness and give opportunity to say, hey, this is important for us as the public to be healthy and prevent these diseases and illnesses. Richard, do you have something?
Are there any good online sources to look for as opposed to the bad ones?
As Chris said, I think the most reliable is the Center for Disease Control, CDC website, and they have all kinds of information on that, which is accurate and peer-reviewed. I think that would be the best source to look at.
Mhm.
There's also some independent groups that I'd be happy to share with you when I can look up their website that have researched immunizations and how they're given, and independently, without any monetary contribution from either side, have said that the vaccines are safe and appropriately given nowadays. Another myth that's out there is spread out the immunizations. I've talked to many parents about that. There's absolutely no evidence that spreading them out helps at all as far as reactions. And indeed, in the research that's been done, when you clump the immunizations together, you get a better antibody response. So the kids that get them clumped together actually have better immunity than the ones that get it spread out. So the routine schedule that's recommended right now is the best we know, and there's no evidence to say any different. And the ones we're immunizing against, again, the current 14 are well proven, have good track records. There's also a new set of immunizations coming out. There's some updates of the ones that already exist, which are going to expand the number of species of this virus, of each virus that are covered. So like the HPV or Gardasil vaccine is currently being given to prevent cervical cancer in teenagers and young adults. Instead of having 4 different species in it, is very soon going to have 9, and protection against 9 different viral components of that group. That's already approved, it's already available, so we're going to be updating what we use. There's new vaccines on the horizon. Dengue fever is invading our country from elsewhere. There's just concerns about a lot of different illnesses around that we're going to try to be protecting against in the near future. So this is just the beginning. We got more immunizations coming.
And when you think about the progress that we've made from when they first invented the polio vaccine, when was that, in the 30s?
No,
40s?
it was in the 50s.
50s, okay. Salk, right?
Yes.
Yes. Think about all of those individuals that were impacted by polio. And I keep going back to polio because, that's something that the generation before me saw so frequently in the United States. Children died from it. You're forever, physically changed. And now we don't think about it in the United States. We don't give it a thought. It's like, there's not polio in the United States.
That's indeed true. There is not
Yeah.
any polio in the United States.
Mhm.
But there is in foreign countries still.
Mhm.
And polio is like a lot of other illnesses. Not everybody that had polio died. There was a high mortality rate, yes, a lot of children did die from it, and adults as well. But a few survived. Indeed, if you can imagine, my own parents, when I was approximately 2 years of age, I stopped walking, could not walk, after previously walking. And the doctor said he has polio. Fortunately, within a couple of months, I started walking again. To my knowledge, no other detrimental effects. So I had polio, I'm sure, and was one of the lucky ones who got over it. My immune system reacted to it. I was without any vaccines because I was born in the 50s. It wasn't until early 60s that sugar cube polio vaccine came along. I can remember the first day that they offered it in our system of schools, which it was given at the public schools at that time. My dad was smiling from ear to ear when I got that sugar cube. He said, "Now you won't get polio." Well, Dad already had it, but too bad. I'm already immune to it, but I'll take the sugar cube anyway. It's still good. But anyhow, so if somebody tells you they had polio when they were a child and they lived in the 50s or early 60s, it's probably correct. They probably did. Not everybody died from it, fortunately. I wouldn't be here.
Yeah. I had a regional epidemiologist that worked for the state health department that was from Africa, and he's since left the health department, and my understanding he was going to go to medical school, but this has stuck with me for years after David said this to me. Growing up in Africa, living in a remote village, seeing children die from preventable illness, he said to me, he said, "Chris," he said, "those people that have everything appreciate nothing." So to see children in his tribe die, to witness that, to have people in his own family die, that's why he wanted to go back to school to become a physician, so he could go back home and make a difference in those lives of those individuals. So I think we are charged with a big responsibility to promote not only just everyday wellness, but wellness that's behind the scenes, wellness that includes prevention. we are a society that you get sick, we're going to treat it. Well, we are changing that paradigm to promote wellness, prevention, and immunizations are a huge part of that, And I know the state works with the feds, and I know that there's always that conspiracy theory that it's, it's the government, it's the vaccine manufacturers. That's, you can believe that if you choose to believe that, but we're here as professionals to encourage you to, have your kids immunized, to follow those recommended guidelines. Think of it, like I said earlier, as a protection for your child, whether they're getting in the car, you buckle them in, you put them in the car seat, they have the right protection, right equipment when they're playing sports, and this is basically protection for life from diseases that can cause disability and death. So I'm glad that we have this opportunity to meet and promote vaccine information and wellness, and promote World Immunization Week. It's not just all about us in this little southeast corner of Iowa. We're far bigger than that because we're so migrant. We can be here one day and overseas the next day. So.
And my personal goal is to try to get the immunization rates up in our county to where we can make some real progress. I want to be on the flip side. I want to be one of the highest immunized areas in the state. There's no reason we can't be.
You mentioned that you have patients that come in with, I guess, misinformation. Are you able to steer them on the right information and right paths? Does that happen most of the time when you're able to direct them?
Yeah, I have one article that says why immunize, and on it there's a number of websites listed that are both public and private that discuss this and express what I think is honest truth. I mean, truth is there are some risks to vaccines. There's some risks to any medicine you take. There's risks to any medical treatment you go through. But what's the risk you're comparing it against? Marked difference. During the time I've been in practice, a couple of these vaccines have come to be, which were not when I started. One was a pneumococcal vaccine, which is against pneumonia primarily, and the other one is a Haemophilus B vaccine, which is against Haemophilus influenza B. It's a bacteria, even though it has the word influenza in the name. But those two vaccines changed pediatrics completely. As soon as they started giving them in the studies to find out if they were going to work, there was 100% prevention of any serious illness associated with those two bacteria. They were the two most common infections that kids had in a bacterial realm back when I started 35 years ago. Now you hardly ever see them. It's amazing what those two vaccines have done. I used to see 3 or 4 kids every year with meningitis. Now it's rare to see any. It's just an example.
So I'm just guessing that these cultures, the culture of vaccinations, I guess, can change very quickly. I mean, you just see 60 years ago how the country's dealing with polio. So it can shift quick on how diseases spread and can be prevented.
Absolutely.
Sometimes too, we'll see an increase at the health department. Like, for example, when the measles, with the Disneyland situation, everybody was calling, not everybody, but a lot of people were calling saying, hey, we need to come get an MMR, we need to come get an MMR. And the nurse part of my brain is like, we're here every week to serve you from 1 to 4. You should be current with this. You should be thinking about this. But it comes down to education. It comes down to awareness and promoting that. I know that I'm current. Don't put this out. You can. I don't. It's fine. But I couldn't find proof of my MMR. I could not find documented proof. I know I had them to go to nursing school. I couldn't find it anywhere. So I had to get 2 MMR vaccines because I couldn't find it. So even the nurse has to check her records and be current and be compliant, because it's my responsibility to ensure safety for the people that I'm taking care of. I signed on for that when I became a nurse. It's like Dr. Heitzman signed on for that when he became a physician. It's our responsibility to protect those that we care for. So even healthcare providers have to follow the rules, the suggested rules as well. But we do see an increase. Influenza, we see that in the fall with kids. You know, once influenza starts circulating in the community, we treat others with the same symptoms as influenza. You might not have to do testing on it because you know if it's circulating, it's probably influenza. But once somebody in a classroom has influenza, then it's like, oh my goodness, we need to hurry up and our kids need to get the flu shot now. Or pertussis, sometimes which is whooping cough. About every 5 years we see a spike in the number of pertussis cases. And we've seen those even in children that have had the vaccine. And what they say, the feds and the practitioners say, is the fact that it is a cyclical thing. They're looking at maybe changing the recommendations for that pertussis, maybe giving them an additional booster. But, you know, kids die from pertussis. They become very acutely ill and end up being in the hospital. And as adults, it's recommended that we receive one tetanus booster that has the pertussis vaccine in it as well. So like if you're, you know, babysitting your grandkids or if you have contact with kids, then us as adults need to have one tetanus booster that has pertussis in it as well.
You were discussing or mentioning a few minutes ago about things going on behind the scenes. Could you address or discuss how the companies that provide the vaccines are making adjustments to the morph of these viruses, because they are living things and they grow and they change and all of that? Can you address that, or do you know anything about what's going on behind the scenes there?
Well, an example of rapid changes would be influenza. Influenza changes its genetic components every year. So the CDC and a couple of people in charge of that particular subject have to decide in October what they're going to produce for the following year. So they have to start making it almost 12 months ahead of the season. So they're guessing what's going to be the most popular influenza virus out there a year ahead of time. That's very difficult when they're changing every month. But you know, for example, this year they kind of missed the big influenza A. They didn't get the right one in the vaccine, so the vaccine was only about 30% effective this year for that particular strain. It didn't cross over very well. Sometimes you can get some crossover between one and another one that's very similar. But on the B side of it, there was typically 4 different species in this year's flu vaccine. 2 of them hit right on target. The B virus has prevented a lot of people from getting the B virus. So the vaccine was effective as far as influenza B. Influenza A, not so good. Next year, hopefully they'll do better. But they're already making it for next year. They've already chosen which ones. Companies are out there producing it in order to have an adequate supply. So there's some tough mathematics and tough demographic studies going on all the time to try to figure out what to do with these vaccines.
Thank you.
And the year that we saw H1N1, when that was a single antigen flu vaccine, that was a challenge for the health department and all the providers. I know you can go to pharmacies now offer a lot of immunizations. I know pharmacists have been trained to administer injections. So you can, it's not just the doctor's office or the health department. Sometimes as far as access, that's a great thing, because the more access individuals have to vaccines or service, that's a great thing. On the flip side of that, sometimes it causes a problem with the local infrastructure of the health department, because if you can get stuff at private agencies, then why do we need a health department? So it's kind of a balancing act, so to speak, because when the H1N1 vaccine was available, it only went to health departments. It went to your local health departments, and I worked with the hospital and the providers here at the health center to make sure that they had vaccine available, or we had specific criteria for those people that were able to receive that first round or 2 of that vaccine. I agree with Dr. Heitzman. It's really a challenge when you have to make flu vaccine a year in advance. I know they watch the Southern Hemisphere because they're opposite season of us, and try to make the best educated guess, if you will. But, they look at all of the information, they do research and see what's been circulating, and flu strains hit different pockets of the United States at different times. And then you have to take into account how migrant we are, you get the folks that go to Texas, Florida, or Arizona for the winter, the snowbirds, well, influenza hits those regions at different times, but when you see an influx of people that, got their flu vaccine at a different time, you're going to see spikes and trends. We work with the state epidemiologists. We work with a local hospital infection control officer. We work with Dr. Heitzman in the clinics, and it's the responsibility of the health department to provide the education and the correct information. I know there have been measles in Jefferson County. That was before I was at the health department. I believe it was 2004 or 5, and they had to issue quarantine and isolation orders for the family. So, requesting that they stay at home. So that can happen, and that will happen if we were to have a highly contagious measles case or cases. I don't like to use the word epidemic or outbreak, but that seems to bring panic. But if there was a confirmed case of measles, and true confirmation is obviously with lab work in that instance. And if you've seen a measles, I've never seen an individual with measles, but yeah, once you see it, they say that you will always remember it. So
Another interesting one was a couple years ago. Talk about surprises. All of a sudden, you heard on the news about noroviruses on cruise ships. You heard a lot about it. They just canceled some cruises and had all kinds of problems with people getting sick on a cruise boats. Well, a group of people from Iowa decided to go on a cruise ship together, a number of families. So they went on this cruise ship, got sick, came home, gave it to people in Iowa. So we had an outbreak of norovirus a couple years ago, which was totally a surprise to me. Caught off guard, and no vaccine, just supportive cares, but it was a nasty GI bug and caused a lot of complaints. And finally they got that extinguished, but just an example of how unexpectedly you'll see something that pops up from somewhere else.
Being in the, working for the government, basically, how would you deal, or how do you deal with parents, especially parents, but anyone that has religious aversions to vaccinations or some vaccinations?
from the health department standpoint, once somebody tells me on their exemption that it's a religious exemption, it stops there. I take their word for that. I cannot ask, what religion they belong to, what religion they practice, what their spiritual or religious beliefs are. If they tell me it's against their religion, or their religion doesn't believe in that, it stops there. And then I take the provisional as it is.
But you were speaking earlier about, as opposed to individual, being in the public, or the concern for the public health. How do you deal with that?
That's something that's currently being debated in a lot of state houses around the country. Right now, I think there's 19 states that allow religious exemptions, but those are probably going to dwindle because the pressure from public health and from people concerned about public health is increasing. Even the people running for president or thinking about becoming candidates have said things and then retracted them and said other things, and so it's a controversial subject right now, and I don't know what's going to happen in the state of Iowa. There is a bill out there in Iowa about taking away exemption. Now there's still going to be some, because there are a few valid medical exemptions, as Chris mentioned earlier, to not give vaccines, like if you've had a reaction to it, for example, that's documented. But most local reactions are not a reason not to. If you get a sore leg from a vaccine, that's typically just a local reaction. That's not anything to prevent them from getting it again. So we have a list of things we follow as far as who should get it, who shouldn't. But I wouldn't be surprised if if public health doesn't win that battle, and the general interest to keep everybody healthy wins over the individual.
For us as a school, it's the same.
But that's a tough subject.
Yeah,
Same situation. We honor the parents' decision. We're not privy to probing or asking, behind that. So, what our parents choose to do is of their.
Yeah, and I suppose that it is a matter more of making sure that everyone else is vaccinated.
Sure.
So as someone may become a carrier, the public doesn't become an epidemic.
Mhm.
And viruses respond differently to these immunizations as well. For example, measles, until this little outbreak in California, we almost had measles eliminated from the United States. There had not been any new cases of measles for quite some time. And that was going to be a real win if we could get it out of the United States. And hopefully, as this week clarifies, World Immunization Week, hopefully we can get rid of it in the whole world if we can just get our immunizations out to the right kids. So measles was almost eliminated. Now we've got quite a few cases again, so it's like the war is on again. Polio, there's not been a case of polio in this country for a number of years. So there still exists worldwide, but there's not been any here in the United States.
I understand
Smallpox.
tuberculosis is kind of
That's-
making a minor comeback, if you will.
Yeah, that's true.
For lack of a better way to put it.
That is true. Polio's been eliminated. Smallpox has been eliminated. The only place smallpox exists right now is in military labs because they preserve it for germ warfare, which is against my beliefs, and I've signed lists to get my name on the list to say I oppose this. Get rid of that stuff, you know. But anyway,
Are those viruses actually eliminated, or are they just being blocked with these immunizations,
Those-
or both, I suppose?
both those particular ones, but then others offer other challenges, like pertussis, for example, the whooping cough that Chris mentioned. That one we immunize against very well, but it's still out there. It goes what I call subclinical. It goes into like a mild cold in some kids that you can't really tell is pertussis, but that because they've been immunized. So their resistance is somewhat there, somewhat not. They get pertussis, they get over it, you don't know they ever had it. But if there was a susceptible child out there that had no antibodies against it, and that child was together with another one, they'd get pertussis, and that's life-threatening to especially young kids, especially less than 6 months. These kids then take it home to their little siblings and give it to them, and pretty soon you got an RSV epidemic or a pertussis epidemic. And this year we did have a few cases of pertussis out there. So it's something you always got to be resistant to or awake to, because even if they've been immunized, they can still get it. And it still exists, and it's not ever going to go away. It's going to remain in this subclinical state because it can survive that way.
Just kind of hangs out and waits for somebody to not get vaccinated.
That's exactly right. That's exactly right.
Mhm.
So they're different in how they respond. So some of them we can eliminate, some of them we can't.
Do you guys have any other questions?
I have one. You might have talked about this in the minute before I came in, about how immunizing your child not just protects your child, but other children through herd immunity.
Yes.
So is that maybe the most important thing that the parents need to understand about how it's not simply their own child that they're affecting when they decide to get an immunization?
I think that's important, yes, for them to understand that, but I think it's more meaningful to people who have children that cannot, for some medical reason, get a vaccine. If they have an immune deficiency, if they have, some other, they're on chemotherapy, their children are susceptible because their immune system has been knocked out, if you will. They're the ones that get the most angry about being exposed to kids that could easily have gotten immunizations and prevented these diseases and reduced the incidence of exposure. How do you feel if you're one of those parents? You're angry if other people don't take good care of their own kids.
And in public health, we reference herd immunity a lot because it's true. We look at those individuals that can receive the vaccine and should hopefully be getting that as part of their wellness program. But we definitely need to focus on that and encourage that. But sometimes it's all about me. We do see groups of individuals where it's like it's all about me and I'm only going to do what's right for me, and I'm not really focusing on others. It's just about me. Well, when you are in the public service realm, whether it's education, health, or whatever it may be, you look at the greater good. You look at the individual good, but you look at the greater good as well. And we, as providers, depend upon that. We need that to have health for the majority of people.
One thing is, oftentimes in our country, legal things drive what happens. And I'm not going to be surprised at some point in time that a child who reaches 18 or adult age suddenly turns around and sues their parents for not giving them a vaccine, especially if they have an illness and had a bad outcome. People would say, oh my gosh, it's not going to happen. Well, quite a number of years ago, I was out in California at a pediatric meeting, and we were being petitioned on the street as we walked into our pediatric meeting for children not to be circumcised. And they had a number of lawsuits set up where the male child was suing their parents for circumcising them because it was an unnecessary medical procedure. And that was real popular for a couple of years. There was a lot of law cases about it. It hit our pediatric literature pretty heavy. So it was a very interesting situation, a child suing their parents for being circumcised. How is that much different than a child suing their parents for a vaccine they didn't get? You got to consider the child's rights as well.
Do you guys have anything else?
Any other questions?
Any other questions or comments, or now you're going to cut it and tweak it and do whatever you need to, right?
Magic of it.
I guess I just have one that I hadn't heard you talk about. That was maybe 15 years ago, maybe 20 years ago, it could have been more recent than that. There was a study came out that linked autism to vaccines. And I think that's probably what a lot of the parents are worried about. Can you speak to, has that study been withdrawn or debunked,
No.
or is there other evidence on the other side?
How mean and dirty do you want to get? The truth is, to take it off the top, what is reportable and discussable is the fact that there was one ill-developed study that has since been proven wrong, and the guy has lost his license, lost his position in the Royal Medical field in Britain, where he was from, and been sued for it as well because he did it to make money. I'll tell you more details of that in the second part of this, but anyway. The one study that showed a connection with autism was proven wrong. And since that time, 194 other studies have been done, and none of them showed any connection between MMR and autism. Zero. That's been reviewed by the medical people, medical magazines and books. It's been reviewed by the United States Supreme Court because somebody wanted to sue the manufacturer of the vaccine. And after looking at the data, the Supreme Court said there's absolutely no basis for this. Throw it out, get it out of here. And they looked at it for a number of weeks and studied, I can't remember how many thousand papers on it, and had hundreds of witnesses come in and testify. It was a big deal. And there was absolutely no connection between autism and MMR. That was the only one that was ever suspicioned to cause it. So, does that answer your question?
Yes.
Now the down and dirty is, there was a group of lawyers that hired this physician to do the study and come out with that result so they could take on the vaccine companies. And so the physician that did the study got paid a bunch of money, or was supposed to get paid a bunch of money, and the lawyers were expecting to make a bunch. And they caught him in the act. So that wasn't science-driven.
And just about autism too, I think we see numerous children diagnosed with autism. I mean, Dr. Heitzman could speak to that, but I think there are a lot of things in our environment, in our foods, in the things we do and don't do as humans now in this generation versus in generations past. And I think that that's what's driving different diseases and diagnoses in our kids today. And when we see children, we see them have, adult diseases. In my generation, they're diabetic, type 2 diabetes when they're teenagers. They have high blood pressure. They have heart disease. And when you look at the things that we eat and the inactivity of our kids, it's astounding.
Chris is exactly right about that regarding what vaccine were you talking about?
I wasn't talking, I just was, just autism in general.
Autism,
and
With regard to
other
autism,
environmental things.
the current thinking is that there's a genetic kind of predisposed genetic nature for these kids who get autism, and that something in our environment is tweaking the DNA and turning on things that's causing the kids to have autism. We don't know what that factor is yet, obviously, but they're looking hard and heavy, but they think it's genetic based, think it's environmental. That's the current thinking about autism, is what's causing it. It's the combination of those two things. Other thing that's happened with autism is the number game. Again, back just a few years ago, they said it happened in 1 in 150 kids. Well, now it's down to like 1 in 33. What changed during that time? What changed was the definition by the Psychiatry Association of what autism is. They threw several things all in one group, and now they call them autism spectrum disorder. That's the current label for all these kids that have autism, but it also includes kids with pervasive developmental disorders, Asperger's, and other things that we used to call them and put them in different categories. Now they've clumped them all together. So the number didn't really go from 155 to 33. The classification system drug it from 150 to 33. So they've changed the rules on you in the middle of the game. So now they're saying, whoa, what's all this autism about? Well, it really hasn't changed that much. The frequency has not. The definition did.
The broader definition.
Much broader definition. That's why the numbers drop. But it's tough to sort out, to feather out how much is a real increase and how much is definition increase. Because now we're all using autism spectrum disorder as our diagnosis. Just further complicates things.